The data on insulin resistance, there was a paper published in January of this year showing that lowering uric acid, this was with a different drug, was associated with improvement of insulin resistance in patients with heart failure. So this is exciting, but it needs to be, again, we need larger numbers of patients. We need a full clinical trial. In terms of weight loss, in this most recent trial that Dr. Feig did, there's like a 15-pound weight difference between the control and the allopurinol group at the end of the study, and this was only a several-month study. So this suggests that this drug could be useful in preventing weight gain in particular. But again, the study's not yet published and, has to survive peer review and so forth. And we need more patients before we can really say that this will work. There are additional studies that are in press that show benefits on cardiovascular events and on kidney function, but they're not yet published yet, and we have to wait to see how the scientific community reviews these findings. But it is very exciting. It does look like this could be an important cardiovascular target. And as such, we need to, or risk factor, and as such, we need to do more studies on this. Now, what's the danger of giving allopurinol? Well, there are some risks because rarely allopurinol can cause a life-threatening allergic reaction where you get this terrible rash, and the rash can cause the skin to flake off. You can end up in the intensive care unit. I mean, it's very rare, but it can occur. It's called the Stevens-Johnson syndrome, and it's really not something anyone wants. So allopurinol is not without some risks. You can get abnormal liver function tests from it at very high doses. It may itself cause some kidney trouble. So allopurinol is not the perfect drug. Now, there are other drugs being developed to lower uric acid. So if it turns out that this is a really important cardiovascular target or risk factor that we need to reduce, there are going to be drugs that can do it. And, of course, low fructose diet does lower uric acid, probably 1 to 2 milligrams %. And restricting certain other foods may have some impact as well. So it's still early, but it does look very promising that it is an important risk factor.
Well, I thank you for those comments. I certainly appreciate the caution of making a global recommendation without the scientific studies and peer-reviewed studies to support that recommendation. But and I want to preface too that those listening know that I really don't advocate drugs at all, and my goal when I see patients is really to get them off of all their drugs and using natural lifestyle alternatives to compensate for those shifts. However, I'm wondering if you could just make a comment because on the use of allopurinol, one of the newly found derivatives that it might be safer, as use of the drug as a crutch, because it would seem to me that if you have this really elevated risk factor, that the most logical and rational approach is to be aggressive with the fructose restriction and to implement some really good comprehensive exercise program to decrease insulin resistance, and ultimately that will help. And it's the long-term solution. But in the interim, especially if they're at high risk for a challenge, I'm wondering if it makes sense to lower it pharmacologically, because on the assumption, this is where I'm not sure because I don't understand the physiology as well, because when you lower the uric acid, are you improving all the mechanisms that actually lead to the maintenance of that high uric acid? So in other words, that the lifestyle adjustments that you're making will even be synergistically more effective because the uric acid is artificially lowered.
Again, you're right on, Joe. So we believe that that's true. I have submitted some grants to the National Institute of Health. We have one big multi-center trial that's going to be reviewed in June, in which we are suggesting that lowering uric acid can be an adjunct to exercise and diet to help prevent the development of obesity and insulin resistance in adolescents. This is a study that will be led by Dan Feig. We also have put in, it looks like allopurinol and metformin, which is another drug that's often used to treat early diabetes and frank diabetes. But that the combination of this may actually help reset the system so that you can lose weight more easily, especially with diet and exercise. And I should mention that low fructose diet and exercise both lower uric acid as well. But it's very true that there may be some benefits, particularly in our society with pharmacologically lowering uric acid. But we'll have to see how the clinical trials show. But I think you're right on the money.
And from your review of the literature and your clinical experience, what type of time frame would you expect to see the maximum benefit? Would it be on order of 1 or 2 weeks or 1 or 2 months? Because that's I've never used it for that application before, so I'm just not sure of the timing on it.
We don't absolutely know, but I would guess, based upon our experimental studies, that you might only need this for 2 months or so, in the range of 1 to 3 months, to kind of help reset the system that would then allow you to become less sensitive to the effects of sugar.
All right, well, great. Well, I know you, as a leading expert and researcher in the field, you're not allowed to make recommendations without strong scientific support. But since I'm not one of those researchers, I personally, when I consult with patients, it seems to me an appropriate use, and clearly using it as a crutch, like one might use an antibiotic to get over strep throat, or actually literally a cast if you've broken your bone, to allow your system to heal, to reset to where it's normal physiology. The danger, of course, is that many clinicians will get sloppy and use it as the only approach, and that is absolutely inappropriate and is in my mind, because you're not treating the cause.
You're right, and actually, we have a bunch of studies proposed, not only in this country, but also in several other countries, where we're going to be trying those exact things of, short-term treatments with these agents that we think will help reset the system to make you less sensitive to the effects of fructose. And so, hopefully 1 year from now, we'll actually have results from some of these studies. So let's hope that they are positive and that we can really make an impact on this important epidemic.
We'll just have to wait to see what the research shows, but thank you for your insights on that. And those are really the end of the questions that I had from our first interview, but what I wanted to focus on now is some of your newest research. And let me first state that much of the research done in traditional medicine is sort of relatively suspect, and that's as a result of the massive conflict of interest that occurs with the drug companies and funding them and writing the studies and having them actually approved in the journals. And it's really a questionable area. And we've actually done some interviews with some experts on this to discuss it in more detail. But what I love about your research is that because there's really no drug, allopurinol is a generic drug. There's really no investment or corporate interest to promote this. It's pure research. They're really sort of the paragon, the ultimate of what science-based medicine should be, with really restricted conflict of interest, and as far as I can see. So it's one of the reasons I'm really so excited about what you're doing. And you've actually told me right before we just started the recording that you actually have done some research. So I'm wondering, and I don't want to pressure you because this is data that can't be released until it's actually published. So if you can share or give us some highlights, which you can, without jeopardizing any of your work, that'd be great.
Well, the whole uric acid story is a very exciting story because we have incredible epidemiologic data linking uric acid with heart disease, linking uric acid with obesity, linking uric acid with diabetes, and so forth. The epidemiologic studies are overwhelming. The experimental studies now confirm or actually provide evidence that uric acid isn't just a marker, but may actually have a true role in that process. But there are two aspects to this whole story that have kept it from being accepted in the scientific community. And the two aspects are, one, everyone would like to see clinical proof in the human that the animal studies, are true. In other words, does lowering uric acid prevent hypertension, treat hypertension, prevent obesity, treat obesity, and so forth? Those studies are now being